Black Health Equity Advocacy Week was launched in 2023 to address the pressing need to bridge the health disparities gap for Black Californians. Spearheaded by Assembly Member Akila Weber, MD, and supported by the California Legislative Black Caucus. This initiative calls on everyone to join in spreading awareness and mobilizing communities to transform the health landscape in California. Hear from our next generation of healthcare providers from UCR's School of Medicine's program and medical education, students for their input on health equity. These students are receiving specialized training to address the healthcare needs of the African, Black, and Caribbean communities of inland Southern California. What does Black health equity mean to you as a future healthcare provider, and what actions are you taking to advocate for Black health?
Health equity to me.
Health equity to me.
Health equity and what it means to me.
Health equity means health equity.
And health equity as a future healthcare provider. Health equity means.
So my name is Marina Gad El Sayed, and I'm a first-year medical student at UC Riverside School of Medicine. Health equity to me as a future healthcare provider means ensuring that every individual, regardless of their background or circumstances, has the opportunity to achieve their highest level of health. It's about addressing the systemic injustices and barriers that disproportionately affect the African, Black, and Caribbean communities, so that everyone has equal access to healthcare resources, services, and opportunities for better health outcomes. To advocate for Black health, I am taking several actions. Firstly, I am educating myself on the social determinants of health that impact our communities, such as systemic racism, lack of access to healthcare, and poverty. And I am also engaging with community organizations and leaders to understand the community's needs and priorities, and to collaborate on initiatives that address healthcare disparities. I am advocating within the healthcare system for policies and practices that promote equity and inclusion, such as structural competency training for healthcare providers and increasing diversity in the workforce, as well as implementing strategies to reduce bias and discrimination in healthcare delivery. Overall, my goal is to be a compassionate and culturally competent healthcare provider who not only treats individuals, but also works on dismantling the structures of inequality that contribute to health disparities in the ABC community.
Hello. Health equity to me means ensuring that every single community member in African, Black, and Caribbean communities have the opportunity to achieve the highest level of health in a way that works for them. And the actions that I'm taking to promote Black health are listening to the needs of African American community members at the free clinics where I volunteer, and working with local organizations who are already providing resources to African, Black, and Caribbean communities, extra skills that they need in order to help the same community members advocate for themselves in the healthcare system. Thank you.
So, hi, my name is Lindsay. I'm a first-year medical student at UCR. And I just wanted to talk a little bit about health equity and what it means to me. To me, health equity and achieving health equity means being able to provide people with the opportunity to not just achieve their best possible state of health, but also to give them access to the tools that they need to manage their health. I think a lot of times health equity and quality is often used interchangeably, but it's not the same thing, because with equality, everyone has access to the same things, but when it comes to health, especially, every group's needs are different, and so we need to be a little bit more particular in terms of the tools and the help that we're giving to each community, because one's community needs might differ from another community's needs. In terms of what I am doing as a first-year medical student to advocate for Black health, I am part of the Prime program at UC Riverside, which is a program in medical education that focuses on the African, Black, and Caribbean community. And, as part of one of our projects that we're working on actually currently together as a group is to teach self-advocacy to patients, which could be a tool, like I said earlier, just being able to equip members of our community with tools that might be helpful for them to be able to achieve the best possible care and their most optimum health that they can be in. And so we are currently working on this project and working with our community to see what they need and what they want to focus on in terms of what they feel like they need to work on in terms of their self-advocacy and the health issues that they are currently experiencing. And also, I'm grateful to be part of the Prime program, which has allowed me so many other opportunities, like being part of California Black Health Network's Health Equity Advocacy Training Program for the 2024 cohort. And through that, we've learned how legislature is made. And so we're currently working on a project also as a group, for this year's cohort to identify issues that are particular to the Inland Empire and specifically the Black community in the Inland Empire. So figuring out issues that are not yet passed the legislature, or if they are, they need to be amended so that we can improve the health of those in our community around us. So I'm so excited to work on that and hopefully be able to present this to members of Assembly and hopefully be able to at least make some change. And so I'm looking forward to learning more and more opportunities to continue to learn from my community and also empower my community. As part of the Prime program, we're also just learning how to address the needs specifically of the Black community, and through programs like the HEAT program by the CBHN network, we will be able to hopefully make change and create health equity in the future for our community.
As a future healthcare provider, health equity means ensuring that all patients have every opportunity to access healthcare, receive treatments, and experience the best health outcomes, regardless of their economic status, their race, ethnicity, gender, or other demographics. Health equity requires a commitment to understanding and respecting diverse backgrounds in order to provide culturally competent care. Moreover, it means being cognizant of the systemic barriers and racial discrimination that exist in healthcare and continually working to eliminate those disparities to ensure that every patient can be adequately and effectively cared for. As a Prime ABC scholar and first-year medical student, I've had the unique opportunity to educate myself in topics like structural racism in health, intersectionality in Black identity, and African American studies that focus on the histories of African diaspora communities. This knowledge has given me a greater understanding of both the communities I serve and of how their lived experiences impact their health outcomes. Alongside my peers in the Prime program, we are advocating for Black health through a longitudinal research project. This project brings knowledge about chronic health conditions that typically affect Black communities the most, like diabetes and hypertension, as well as other salient health conditions like maternal health, men's mental health, and childhood neurologic disorders to African, Black, and Caribbean patients so that they're more equipped to recognize the signs and symptoms of various health conditions, so that they're able to access resources that help them manage their conditions, and so that they have the tools they need to advocate for more adequate care in physician-patient settings. Essentially, by passing on medical knowledge, we're hopeful that the health disparities that pervade our community are mitigated.
Hi everyone, my name is Damala Adeyemo. I'm a first-year medical student at UCR Riverside School of Medicine. I'm also part of the PRIME program, which focuses on the ABC community, so that's the African, Black, and Caribbean community. And this week is the Black Health Equity Advocacy Week, and I just want to talk more about what I think about health equity, especially as the future physician. I think for me, in the ideal world, what I would think health equity is where everyone, regardless of their race, their gender, and regardless of their socioeconomic status, they have access to quality healthcare, especially when they need it. So not having it late or when they don't need it anymore, but when they need it. So starting from preventative care to managing chronic diseases, I think just being able to have access to that healthcare, especially since there's resources, there's research being done on how we can improve different health outcomes. So if everyone had access to those resources in a timely manner, I think that would be health equity to me. And I say, as a medical student, the way I try to promote that, especially as someone who's also learning about the different struggles that community members, especially from members in the ABC community, face. I think one thing that I try to do is when I'm out in the hospitals or in the community, or if I'm working with a doctor, and let's say we have a patient and let's say the doctor did not prescribe the medication that I think will be helpful, I can always just suggest oh, have we considered this? So I think as a medical student, it's very easy to just be oh, we have all these ideas of how we can really help our patient. So one thing I've been trying to do more often is just advocating for my patients, especially when I know that they might not understand the things that they might need, but also also talking to them, understanding what they need, because they also it's their care, it's their health care. But if there's anything you think that can be beneficial for the patient, talking to the provider and then talking to the patient as well, and seeing if there's a way that we can advocate for that patient to get the best care they need. But that's what I think about health advocacy and health equity. And hopefully in an ideal world, everyone can have access to the care they need appropriately, so they can live a healthy life. Thank you.
So, as a future physician, health equity to me means giving personalized care to medically underserved communities. Black communities have a higher risk of chronic health conditions due to the health disparities that they experience, whether that's from environmental or social aspects. These are things that are unique to the health of the Black community. And so health equity to me means taking those factors into account when giving care. In this point of my medical education and journey to becoming a physician, the actions I take to advocate for Black health is really through education. I want to educate the Black community on how to self-advocate, how to go into their health appointments feeling like they understand the information that's being told to them, knowing whatever medications that they prefer, just giving and bringing more confidence into the Black community to be able to demand the health that they so rightly deserve. And so, another aspect of that is also just breaking down common misconceptions about Black health that influence their care with colleagues and other healthcare providers. So overall, these are the actions that I'm taking to advocate for Black health.
As a future healthcare provider, health equity means ensuring that all individuals, regardless of their race, their socioeconomic status, or other demographic factors, have access to high-quality healthcare and the opportunity to achieve optimal health outcomes. As a future provider, some of the actions that I'm taking to advocate for Black health includes addressing and also advancing health equity in the Black community. I'm learning to identify and dismantle systemic barriers and biases that contribute to disparities in the healthcare when it comes to access or the outcomes. This includes advocating for policies and practices that contribute and promote inclusivity, fairness, justice in the healthcare delivery. I'm also teaming up with groups like the Center of Healthy Community to hear and support Black voices. Partnering with our community allows me to listen and also understand, thereby having a better way to advocate and also amplify the voices of Black Californians and support community-driven approaches to healthcare or to health equity. I'm learning to improve my health literacy and promoting positive health behavior within the Black community. I'm working to educate patients on disease prevention, early intervention, which is really important for me as a medical provider, and the importance of regular checkups and screenings. By empowering Black individuals to take an active role in their healthcare, we can address some of the issues that health disparity tends to bring up and also foster change. In the end, my aim is to shake up the system and to team up with the Black communities for healthier living. It's not just a job for me, it's a moral duty that I stand by.
We've got the power to reclaim our health, rewrite our health story, change health policy, change the narrative, and make the healthcare system work better for us. Mark your calendars for BHEAW 2025 on May 5th through May 9th.